So I am very excited to chat with Dr. Felice Gersh as we are going to be talking about polycystic ovarian syndrome, just diving into hormones, especially estrogen. And so let me go ahead and give Dr. Gersh's impressive bio as Dr. Felice Gersh is a board certified OBGYN in integrative medicine and is a multi award winning author, speaker, and busy clinician. She was one of the first dual board certified integrative gynecologists in the United States, and she is the author of multiple best selling books, including PCOS SOS, a gynecologist lifeline to naturally restore your rhythms, hormones, and happiness, PCOS SOS Fertility Fast Track, the 12-week plan to optimize your chances of a successful pregnancy and a healthy baby, and menopause 50 things you need to know, what to expect during the 3 stages of menopause. And she combines the most evidence based, safest, and efficacious therapeutics to help women of all ages optimize their health. And thank you so much, Dr. Gersh. It's a pleasure having you on the podcast.
Well, thank you for inviting me. And I'm really excited ever and always to get to talk about my favorite issue that so many women face, PCOS.
Yeah. So, with that being said, let's give a little bit more of your background. How did you focus on PCOS? Obviously, you're OBGYN and you deal a lot with women's health issues and hormones. But again, you have a great deal of experience with PCOS. So, yeah, if you could talk a little bit about that, please.
Well, this is a familiar story in many ways for us in healthcare. We do often get the most interest in our own personal journeys involving our own health. And I had to diagnose and treat my own PCOS, and I didn't get any help from like highly respected OBGYNs in my medical school, in my residency. And finally, I had to do my own deep dive and discover that the reason I went 2 years without a period, I had endless acne issues, I couldn't get pregnant, was, oh, I have PCOS. And then I saw in my own private practice so many women developing PCOS, many more so than I saw in the early stages of my career when I was a resident. It's like, this is like an epidemic now. And so many of them came to me after seeing many previous doctors and didn't even get a diagnosis, let alone a therapeutic approach to treating it. So, like so many of us, we just took the bull by the horns, and I just had to figure it all out, looking at the science, the data, and really do a deep dive into what is going on in the bodies of women with PCOS. And whenever you hear the word S for syndrome, it means it's a grab bag. It's an all-inclusive syndrome. And that means that there can be different etiologies. So you got to then like go through and see what's the underlying cause. And that's where the integrative approach becomes so critical, that we don't just treat symptoms, which is not an insignificant thing to do. You do want to treat symptoms, but we want to really get to the basic, like root causes as much as possible to try to really resolve the problem, not just cover up symptoms. And so it's just been an ongoing journey for me for decades, trying to really unravel this issue. And finally, after many years of starting and then never finishing, I got together with my brilliant daughter, who is my co-writer on all my books, and she put me on a schedule, like you have to deliver this chapter and dictate this for me and so on. And together we really got our books written on PCOS, and then just continue the journey of treating PCOS, educating on PCOS, and helping women all over the world to deal with this very common but often devastating healthcare condition.
So, you mentioned very common. How common is it?
Well, no one really keeps good data, but from the best that we can judge, it's anywhere from 10 up to 20 or more percent of reproductive aged women. And it doesn't go away when you hit menopause. It just sort of blends into the other issues that women with menopause are dealing with. But women now, finally, it's been recognized. It wasn't for many years that women who have had PCOS for all their reproductive years, when they get into menopause, they have a higher rate of developing cardiovascular disease and other issues involving metabolic dysregulation. So it's not like it disappears, it just becomes less readily evident because of some of the symptom changes. But the underlying metabolic changes and underlying risks remain and are actually accelerated in women who've had PCOS. So it's just such a prevalent thing. When you think about it, like somewhere at least the bare minimum is 10% of reproductive age women, but I really think it's closer to 15 or even 20%. When I was talking about PCOS a few years back, it was a little before the pandemic, I was in India, and nobody wants to admit they have PCOS there if they're women in India, because it's a fertility problem as well as other things. And they don't want to have that stigma. But they think that in that particular population, it's well over 30% of young Indian women now are dealing with PCOS. That's how it's a worldwide problem. There is no continent that doesn't have it. In fact, some of the best research on PCOS has come out of China and Iran. It's amazing how this problem is everywhere in every group, every ethnicity.
Wow, 30%. I mean, even like 10% is pretty high. And so 30% is, yeah, really astronomically high. And like most other health conditions, do you find that it has been increasing over the years, like compared to like 10, 15, 20 years ago?
Absolutely. That has been not only my observation, it's everyone's who's in this field. And we believe it's driven by modern lifestyle changes. The diet, that the what we call the SAD diet, the standard American diet, filled with processed foods devoid of essential nutrients and fiber, the loss of our vital circadian rhythm due to all the blue light exposures and lack of adequate sunlight. So people often just in rooms with no windows, or they're covered, and then they have all that blue light, television, computer screens, phones, and so on, that they look at into the wee hours of the night often. Sometimes people checking their cell phones at 2 a.m. and getting that blue light into their eyes. And just like loss of activity, the sedentary lifestyles that so many people are leading, and the ubiquitous chemicals, the endocrine disruptors, these chemicals that interfere with the normal hormonal signaling functions in the body, particularly estrogen endocrine disruptors that we call xenoestrogens. So it's the conglomeration of all of the things that have changed in the world since ancient times. I mean, now people live longer, and that's fantastic, but we have a whole new array of medical issues that we're confronted with. And this great increase in the incidence of PCOS is one of the offshoots of modern living, and the chemicals, the diet, the stress, the change in sleep habits, light exposures, and so on have all joined together to exacerbate the underlying issues that are causational in terms of PCOS.
Yeah, the endocrine disruptors are still very rampant. You figure, especially like with bottled water, that less people would be drinking about it, just because I think there is more awareness. I mean, it's in the research. It's not just people saying that, bisphenol A and these other endocrine disruptors are issues. But if you walk into like if we go to like Costco, we still see like, like it's like amazing how many cases of bottled water there are, and people still, just that's what they're drinking every day. Again, not assume a lot of people listening to this are not doing that, but still in general. And I'm not surprised you mentioned that, but getting into the circadian rhythm and even the blue light. So you're saying that, just having it, not getting enough sleep, being exposed to a lot of blue light also could be a factor when it comes to development of PCOS.
Absolutely. It's all related. And I'm glad you mentioned like BPA, because BPA, the bisphenol A, is the endocrine disruptor that's had the most research in women with PCOS. I'm sure they're all involved, and there's some about phthalates, the pervasive scents and the soft plastics and so on. But BPA, they've actually shown that in women who are pregnant, that the BPA in them, and BPA is in so many different things, and like plastics and can liners, and it used to be like dental sealants, baby bottles. It's really in almost every single person when they test for it, but it actually concentrates in the fetus. So the levels in the mother are significantly lower than the levels in the fetus. And this is a very, very powerful endocrine disruptor. And when the endocrine system, the hormonal system of the body, is being developed during fetal times, it only gets one chance to be developed properly. And what they've found is that the receptors for estrogen, and there's three types, but the alpha and the beta are altered in women who develop the worst PCOS because of these exposures in utero. And like I said, the most research is with BPA. So, and then it turns out that estrogen that comes from the ovaries, estradiol, known as E2, because there are three estrogens in an adult female: E1, estrone; E2, which is the one the ovaries make, estradiol; and E3, which is estriol, the dominant estrogen that the placenta makes in pregnancy. And it turns out that inherently, genetically, women with PCOS have a little bit less ability to convert testosterone, the precursor hormone that's also made in the ovary, into estradiol through the action of an enzyme called aromatase. Now, that is a very mild deficiency of estradiol in a healthy woman from ancient times. But now this problem of not adequately producing estradiol becomes magnified in ways we're still even just learning about in women with PCOS. But it's like fuel to the fire when you don't make enough estradiol in the ovary, and then the estrogen receptors are not working well, like they're not receiving so well, so that the signaling function of the hormone is suboptimal because the receptors are not as receptive because of the impact in uterine life, and then also probably at key times during like puberty. In fact, when they've done levels of adult women with BPA, with PCOS, they're finding higher levels in them even as adults. And that may be not because they're exposed to more, but because maybe genetically they're not as good at getting rid of it and processing it through the liver. So it's like this whole like perfect storm in women. And it turns out that estradiol is really critical for managing and maintaining our master clock, which sits atop the optic nerve in the hypothalamus portion of the brain that helps to control all the timing of our organs and our circadian rhythm. So when you don't have enough estrogen being made by the ovaries, or the receptors aren't working properly, you innately have like a state of jet lag. So you're like living across different time zones. And that is like disaster for metabolism, which is creation, distribution, utilization of energy. So you have this problem. And then when you compound it, it's like, that's why it's always insult to injury, by getting too much blue light, by not getting adequate sunlight, by going to bed at the wrong time. And then you're just taking, once again, a problem that's already there and just making it that much worse. So I always say the first step in solving a problem is to understand it. And that's why it's to really understand how foundational it is to having the circadian rhythm, to having light, to having the right foods, to having a healthy gut. And all that plays into having a healthy metabolism and a healthy reproductive system, how it's all intertwined. And all of this is sort of in disarray in women with PCOS today.
Definitely want to talk more about estrogen, but when it comes to testosterone, so you mentioned the problems with conversion of testosterone into estradiol. And is that why it's one of the characteristics is the high androgens, like high testosterone when it comes to PCOS?
That's totally perceptive of you. That is correct. So if you think of it as now, this is, remember, PCOS is a syndrome. So I'm going to talk about what we'll call classic or the most conventional form of PCOS, because there's also other ways that you can have the manifestations that are very, very similar, but they're actually from different underlying causes. That's what makes it a little bit confusing to a lot of people. But if we talk about what we'll call the mainstay type of PCOS, if you think of it as an assembly line, first the ovaries make testosterone, and then the testosterone moves from one part to a different part of the ovary. It moves to the granulosa cells, where the enzyme aromatase, under the influence of the hormone from the pituitary gland called FSH, follicle stimulating hormone, converts the testosterone into estradiol. Now, the pituitary gland, under the influence of the brain, makes LH, luteinizing hormone. That's the hormone that tells the ovary to make testosterone. Now, the brain has sensors. It's like, mastering everything, keeping control and keeping tags on everything. So if the brain notices there's not enough estrogen being produced from the ovary, it will put out a signal to the pituitary to make more LH, because from LH, you will then trigger the production of testosterone, and all estradiol that's produced in the ovary, E2, is derived from the conversion of the testosterone. So if the brain says, please, ovaries, make more estrogen. So it tells the pituitary to tell the ovary to make more testosterone. But there's like a snag here in the assembly line. So you're making plenty of testosterone, totally different skill set to make testosterone, but you're not efficiently converting it into the estrogen. So you end up with too much testosterone, not enough estrogen, and the brain keeps saying, where's my estrogen? Make more. So it keeps putting out more LH through the pituitary and making more testosterone. Now, when you have more testosterone, it actually begets more testosterone. It changes the gut microbiome. And then when you have an altered gut microbiome under the influence of testosterone, it turns out that even stimulates more testosterone. And then you have all that testosterone, not enough estrogen. It creates inflammation in the body through an altered gut microbiome and so on. And there's like a whole bunch of different mechanisms that come into play. But when you have more inflammation, you have more insulin resistance. And then you have more insulin, which actually also triggers through the increased production of another little hormone, IGF-1, insulin-like growth factor 1, and that actually can move into the ovary, and that actually triggers the ovary to make even more testosterone. So you have inflammation, insulin resistance, more testosterone driving, the fuel to the fire. And so you can see where this dynamic is going. So you have a woman, not enough estrogen, too much testosterone, too much inflammation, insulin resistance, abnormal gut microbiome, leaky gut, and it's like metabolic havoc. And so you have to then look at each part of the equation to help each woman to then overcome what's going on in her body that's causing so much havoc in terms of, then she develops acne. So because of the elevated testosterone, women with PCOS often will get cystic acne, like in the jawline, which is very resistant to the conventional treatments. It's very difficult to clear it up. They'll often have facial hair, and they have to deal with either electrolysis, laser, shaving, and it's just always, like, where's, extra hair that's not making women feel feminine. And they have the female version of male pattern hair loss that's called androgenic alopecia. So they often have very fine and thin hair, which also isn't like feeding their egos either. And then because of all of this problem, they're not ovulating, because the same trigger to making the estrogen is also helping to trigger ovulation. That's not happening regularly. And so they're irregular cycles, they are having infertility. PCOS is the #1 cause of female infertility. So, and they have very high rates when they do get pregnant of complications because of all this inflammation and insulin resistance going on in their bodies. So they have high rates of miscarriages, preeclampsia, gestational diabetes, hypertension, babies that are too large or babies that are too small because of placental problems, preterm delivery. So it's like a really huge problem in terms of their overall body health and their reproductive function.
So, if I'm understanding you correctly, it seems like all of this is stemming from too much testosterone caused by the lack of conversion of testosterone into estradiol. So, excess testosterone alters the gut microbiome, causes inflammation, which leads to insulin resistance, which I was going to talk to you about. It's really just a whole vicious cycle. But it sounds like really testosterone, that again, that conversion process is the culprit then.
Well, that's the initial, but then when you add in, like I mentioned, that the estrogen receptors in the body are malfunctioning because of exposures to endocrine disruptors, it's like even adding that much more level of complexity because it turns out that estrogen in the form of estradiol, that's the form that is the essential one from the ovaries, that hormone has receptors in every single organ system of the body. And it's key to regulating our gut function, our neurological systems, our cardiovascular systems, musculoskeletal systems, our skin, and so on. So it turns out if you have malfunctioning of the estrogen receptors, they're not as sensitive, kind of like a similar thing a lot of people have heard of, like insulin resistance. And then the insulin doesn't work properly because of resistance of the receptor. That's the same thing. So you can think of it as estrogen receptor resistance that is caused by the exposure to these endocrine disruptors. So without adequate estrogen being produced in the ovary and without adequate function of the receptors, then it's just that much worse because estrogen, the form of estradiol, actually maintains the production of nitric oxide, which keeps arteries dilated and healthy so you don't get hypertension. It works to keep the proper neurotransmitters like serotonin and dopamine, acetylcholine, which are involved in memory, focus, emotions of all kinds in the brain. It maintains the autonomic nervous system so that you don't have like sweating or problems with sleep and emotions and tachycardia. So many things are going on when you don't have enough estradiol being produced and it's not functioning properly on the receptors. And then you have all this surplus testosterone, which is another big problem from so many perspectives. Having all that extra testosterone is interfering as well in metabolic functioning, gut functioning, and of course, all the side effects that it creates, which is like just horrible for a woman's life. So yeah, you can see it's a big deal. That's why I'm so passionate about it, is because the only conventional treatments have hardly changed at all in many, many years. And we need to think out of the box a lot more about how to approach this condition.
Yeah, and estrogen gets a bad rap sometimes, when you hear like the term estrogen dominance. And again, I'm guilty of using that, as well. But it's really, in most cases, the xenoestrogens and then like synthetic estrogens, like birth control, oral contraceptives, which I guess is another question. Can like taking the pill also be a factor in the development of PCOS?
Well, I actually think so, but I can't prove it. This is a theory that I have been basically thinking about. It turns out that birth control pills, which are really one of the mainstay treatments of PCOS, and it's clearly helpful in certain symptom control issues, like it basically shuts down your ovaries. So that whole thing I described about the assembly line where you make the too much testosterone, it's not converted to the estrogen properly. That's shut down. So if you just take the ovaries offline, then a lot of that is going to be better. And when you have a lot of birth control pill estrogen on board, it increases a protein made by the liver called sex hormone binding globulin, which helps to bind up some of the excess testosterone that is circulating, and that can help with acne. And when you're on birth control pills, it's not real human hormones. They're technically, actually, if you looked it up on toxicology.gov, which is a division of the NIH, National Institutes of Health, the ingredients in birth control pills are technically endocrine disruptors themselves, designed to, of course, prevent fertility. But it's used in other ways, these hormonal but fake human hormones. They're not really human hormones at all, that they can disrupt the way the ovaries work completely. They shut them down, and then you get the hormones that give you the illusion of having regular cycles. You have regular bleeding, but you're not ovulating. Your ovaries aren't doing a darn thing, but it can improve symptoms. But here's the problem. They're not real human hormones. And when you take birth control pills, the main estrogen you get, the most birth control pills that by far have a chemical in them called ethinyl estradiol. So it's not real estradiol, it's ethinyl estradiol. And just putting on that extra molecule changes everything. It's a different chemical. And it turns into estrone primarily when it gets metabolized in the body and through the liver. So most of the estrogen that's circulating turns out to be estrone, which only binds primarily to one of the estrogen receptors called alpha. And that creates an imbalance in the body. The ovaries make estradiol, E2, which has a balanced effect on the different receptors. Because remember, what birth control pills are endocrine disruptors. That's really what they are. And so you have a different effect. And what's happening is that particular type of estrogen is more pro-inflammatory. That's why women on birth control pills have higher risk of getting blood clots. Fortunately, because they're given to people who are younger, their incidence is so low. Even if you increase the risk quite a bit, it's still, in terms of absolute numbers, going to be a low incidence. But the problem is that birth control pills can also tend to cause high blood pressure. That's why we never give birth control pills to old women, to women who are smokers, especially over 30, 35. We don't give it to women who just had a heart attack. We don't give it to women who've had blood clots of any kind, whether in their veins or in their lungs. We don't do that because these are real risks. Well, here's the problem. Women who have PCOS already have an inherent higher risk of blood clots and hypertension, high blood pressure. So this is a higher risk group. And there's actually published data to show that women who have PCOS given birth control pills have a higher risk compared to the average population of women of developing a blood clot. So I feel that the women with PCOS should be viewed similarly to women who've had prior blood clots, or women who have uncontrolled high blood pressure, or smoking women, older women, and so on. It's a higher risk group. Now, here's the other thing. When you're on birth control pills, you're not activating anywhere near as much as you would normally the beta receptor, because mostly what you're putting into the body is estrone, which activates and binds to the alpha receptor. So if you're on birth control pills for a long period of time, the beta receptor may start to malfunction. We know this when we've done research in women in menopause, that it's a little bit of a use it or lose it. If nothing is working on the receptor over time, the hormone receptor becomes less functional, and it may or may not come back just, into pristine shape, or whatever best shape it would be in, if you actually then give them the hormone that they haven't had for quite a bit of time. But what I'm finding is women who have never had any sign in the past of PCOS, never. They got put on birth control pills. because they had cramps or they were sexually active at a young age, a whole variety of reasons, but they didn't have PCOS-like symptoms at the time that they went on birth control pills. And then they're on them for 15, maybe even 20 years. And now they're like in their early 30s. And now they want to think about having a baby, and then they go off. And then suddenly they have every symptom of PCOS. They have irregular cycles. They have terrible acne. They're growing hair. And it's like they go to their doctor and they say, oh, you have PCOS. It's like, I never had PCOS before I went on the pill. So I think that what's happening is that it's creating that problem with the receptors that I talked about that women with PCOS have from their exposures to endocrine disruptors. And maybe it's also impacting how the ovary itself is working, because remember, when you're on birth control pills, the ovaries aren't doing anything. They're like put out of commission. So the ovaries are maybe rusty at even working to create estrogen. So there's something going on here, but I have no published data. But my observation, and I do believe in observation, it's a lower level of evidence than a peer-reviewed, placebo-controlled double-blinded study. But observation is how most every great discovery in the history of mankind ever was, found out. It was through observation, not through a pharmaceutical study. So my observation, and I think it's valid, but I can't prove it, is that long-term use of birth control pills actually can promote the development of PCOS in women when they go off of them.
So, as far as alternative treatments, is it as simple as just trying to minimize, if not completely eliminate, exposure to synthetic estrogens, and birth control, xenoestrogens, doing things to detoxify the estrogens from your body, or does it go beyond that?
Well, it's absolutely everything you just said. Now, I always have to say, being pregnant when you're not ready and don't want to be pregnant is a very big deal. So I'm totally in favor of birth control. I just feel everyone needs what is called informed consent. And if they do go on birth control, there are certain better choices than others. They need to have like a full array of options, and then can choose, like, what do they feel is their best option at that time, understanding potential pros and cons and so on. In terms of approaching women with PCOS, it's a global lifestyle program. You have to deal with everything that you mentioned and then more. You've got to lower exposures as much as humanly possible to all kinds of chemicals, which are so, in cleaning products, in our personal care products, in air that we breathe, water that we drink, it comes off of clothing that we wear, and there's nothing we can do to make us live in a pristine world. That's not going to happen. But we just have to try to make the best choices that we can to lower our toxic exposure, to lower what is called our toxic load, and then to do everything we can to improve gut and liver health, because that's how most of these toxic chemicals get eliminated from our bodies. Now, there are other things that we can incorporate, like saunas, which are helpful. And that is, hydration, because we do also eliminate through the kidneys. So there are a variety of things that we can add on, but the primary is healthy liver, healthy gut. So we deal with that by doing certain, we call it in my office a reset. Some people would call it a detox. It's just giving supplements and food that will support healthy gut integrity, gut function, and healthy liver function, to help the liver to do its job. We can't actually eliminate toxins by anything that we do. What we're doing is try to facilitate our own bodies to do the best job that our bodies can do to eliminate the toxins and lower the toxic exposures. And then we have to work on our circadian rhythm by going to bed at a reasonable time and trying to go to bed and getting up at the same time, sleeping in a very, very dark room so that we can have the optimal production of melatonin, which has been shown to have receptors on the ovaries. So the melatonin that a woman produces at night while she is sleeping is optimizing her ovarian health and her fertility, and then thereby also her metabolic health. So getting adequate sleep is so critical. And like I said, a dark room, I wear a sleep mask because there's too much ambient light coming in my windows and little doodads that have lights in my bedroom and so on. So I like a sleep mask, and they come in very comfortable designs, so everyone can find one that is agreeable to them. And trying to avoid blue light. Ideally, none for a good 2 hours before you go to bed. But if you absolutely must, then get blue light blocking. If it reduces, they shouldn't call it blocking, but blue light reducing glasses to try to reduce the exposure, and try to do other things like before you go to bed, like take a relaxing bath or a shower, listen to podcasts or listen to books on tape, or play games with someone that you live with, like board games, Scrabble, bananagrams, and things like that. Read a paper book, a paper magazine, those things still exist. Just try to stay off of devices as much as you can for a couple of hours before you go to bed. Take some time to do some exercise if you can. Any movement is better than no movement, but fitness is a vital sign. Exercise is medicine, and fitness and exercise plays a huge role in everyone's health, and definitely in women with PCOS. And then eat a whole foods, plant-focused diet. So predominantly eating plants, lots of different vegetables, the colors of the rainbow, and eat some fruit. But don't go crazy overboard, but try to have a lot of servings of vegetables and some fruit every day. Go as much as you can organic. I know it's hard and impossible to be 100%, but as best you can, choose organic. And then try not to eat too much animal protein, which is a little harsh on the digestive system, but just try to keep it to 3 ounces or so. And, if your gut is not SIBO, you don't have small intestinal bacterial overgrowth, another whole topic, but then you should try to eat a lot of fiber foods. Fiber is the food for the gut microbiome, which is disrupted. They had the first study of this came out from China, that women with PCOS have an abnormal gut microbiome and have impaired gut barrier or leaky gut. So we have to work really hard to nurture our gut microbial population, those trillions of microbes that are essential to every health function of our bodies. And the way that you nurture them is with plants, and lots of them, and high fiber foods that they love. And they'll love you back because they'll help you to maintain a proper weight and feel good and have good brain function, good mood. We now know it's linked to everything in the body having the right microbial population or gut microbiome. So I love plants, and just eat diversity, lots of colors, nuts and seeds, and whole grains can actually help you lose weight and lower insulin resistance when they're like buckwheat or millet or quinoa, but they're not powderized, they're not milled, they're just the whole grain itself. And then resistant starch like cold potatoes can actually also nurture your gut microbiome, and they won't raise your blood sugar. And then the other thing that's so critical now, and this is very trendy, but very appropriately so, is time-restricted eating, or some people call it intermittent fasting, which is really important for everyone, and particularly for women with PCOS, because they live kind of a naturally jet-lagged life because of not having their circadian rhythm innately quite right. So you got to do everything to try to work through our peripheral clocks, because every organ has cells that have their own clock genes. And by eating in a timed way, you can actually help properly set the circadian rhythm so that all the organ systems of the body will be working in the same time zone, which is really important for overall health. So by timed eating, that means try not to eat more than 3 times a day. Try to have at least a 12 to 13 hour fast from dinner to breakfast. Try to have your first meal by 2 hours after you're awakened, and try to eat more of your food in the first part of the day when we're most insulin sensitive. and our digestive tract works the best in the first half of the day and kind of goes on strike as the night progresses. So that's why people who eat late at night often have heartburn, indigestion, and so on. So eating late at night is really prevalent, and especially women with PCOS tend to have a disrupted appetite system, and they often want to eat at night. That's like the worst thing you can do. So you have to work really hard to get into the habit of trying to eat more food in the first half, and then stop eating at least 3 hours before you go to bed, and then have that about 13-hour fast until breakfast. All of this can work dramatically to improve the health status of women with PCOS.
Well, thank you for sharing that. So just really with any health condition, you want to take a whole body approach, and it seems like it's no exception with PCOS. So appreciate you sharing that. And so, as you know, most people listening to this have a thyroid or autoimmune thyroid condition. And one question I wanted to ask is there a relationship between PCOS and thyroid health? And one connection I can make is with disruption of the intestinal barrier, and like at least with Graves, Hashimoto's, and other autoimmune conditions, you have that leaky gut component. So that having PCOS in that way might predispose someone to an autoimmune condition such as Graves or Hashimoto's. I don't know if there's any other connections that you're aware of.
Well, you hit it right on the head. As the main one is that since it was now proven, and actually after that first study came out in 2015 from China, multiple other studies have come out showing consistently that women with PCOS have in fact impaired gut barrier, leaky gut, and the wrong gut microbiome, what we call dysbiosis. And that definitely is a precursor to autoimmune. And we know that Hashimoto's thyroiditis is the most common autoimmune. And women with PCOS have substantially higher incidence of Hashimoto's or autoimmune thyroid disease than the average population, which is high enough as it is, as I'm sure all your viewers are aware. And this is a big deal because a lot of conventional doctors are not even screening for the antibodies for thyroid, the anti-TPO, thyroglobulin antibodies. They're not even screening for them. They just get a TSH. So they're missing the whole picture of what's going on in the women with PCOS. And this is really important because this, of course, is critical for overall health. I mean, thyroid, I know you talk about it all the time. Thyroid hormone has receptors everywhere. It's critical for every metabolic function in the body. And here's another sort of interesting fact. Estrogen in the form of estradiol, when you have a normal menstrual cycle and the estrogen levels in the first half are rising and then spike, that creates the ovulation, that actually upregulates or turns on and makes more functional thyroid hormone receptors. So without adequate estrogen present, women will often have symptoms of hypothyroidism, even if you test the levels and they're in the so-called range, but they have symptoms of low thyroid because, once again, it's not just having the hormone, it's having it work properly on the receptors to create the effect in the cells. And when you don't make enough estrogen, then you're not going to have proper thyroid receptor function. So that's like an extra problem for women with PCOS, that even the thyroid they're making isn't working optimally. So this is a huge deal. And thyroid is so critical for everything. Of course, for heart function, for brain function, for metabolic health, for reproductive health. And so this is such a big area that every woman with PCOS needs to have a very comprehensive workup of her thyroid tests, and then looking at the gut to repair the gut. And of course, it's so complicated. The whole thyroid story is so complicated, but you can't properly convert from T4 even to T3 if you don't have a healthy gut and a healthy liver and have all the right nutrients on board, which means you have to have proper digestion, which is often impaired. So thyroid is a huge issue in women with PCOS. So I'm so glad you brought that up.
Yeah, I had to bring it up since again, it's the Save My Thyroid podcast. So definitely wanted to pick your brain when it came to that. And so with testing, I mean, you're absolutely right about doctors not doing a full thyroid panel along with the antibodies. So when it comes to testing for PCOS, if you, I mean, just with all your patients, do you then do all the sex hormones and the pituitary, the FSH, the LH, sex hormone binding globulin, insulin? I mean, pretty much does everybody get the works in your practice?
They do. I love data, so I mean, I'm good at guessing, but I'd rather have data than just do guessing. And absolutely, in women with the typical, we'll say like the mainstay form of PCOS, they will have a high LH to FSH ratio because their LH is going to be produced in really high amounts to try to, because the brain says make more estrogen. So the precursor is testosterone. So the LH goes up. But there's a problem with the FSH, which we don't even fully understand. But the FSH receptors don't seem to be working well. The production of FSH from the pituitary gland is also inadequate. There's not a problem with the feedback system. So you get too much LH and not enough FSH. And so that's a very classic finding, to have this, what they call a high LH FSH ratio. And you always want to check prolactin. So prolactin is a hormone that the pituitary gland makes. And if you have too much prolactin, that can itself increase androgen or testosterone production and the androgens from the adrenal, which includes testosterone. So you have to do a workup to do the rule outs, because I've said that PCOS is a syndrome and there can be other etiologies besides, well, we'll say like the mainstay one. And that's a diagnosis of exclusion, which everyone out there who has PCOS or thinks she has PCOS needs to know. You have to go to a doctor who rules out that you have an adrenal tumor, or what you have is something called acquired or late onset adrenal hyperplasia, or you have a pituitary tumor producing too much prolactin. I mean, there's things that you have to rule out. And then when you rule out those things, you're left with the more standard type of PCOS. So it's really important that to understand, to a significant degree, PCOS is, because it's a syndrome and it's based on findings and symptoms, that you need to rule out the other causes of those same symptoms that would have a different treatment approach.
Makes a lot of sense. And I mean, thank you so much. You shared so much valuable information. I could talk about this for another hour, but before wrapping up, is there anything else, anything like specifically that I didn't ask you that I should have asked you, or anything, any last words that you have?
Well, I think the message I want to make sure I leave everyone out there with is a message of hope, because when I describe what goes on, I know it can be overwhelming and it sounds so negative, but I want you to know that honestly, through lifestyle changes, that alone, just changing what you eat, when you eat, exercise, sleep, working on stress. We didn't even have time to talk about mind body practices and stress and so on. Discovering what your thyroid is like, treating it as necessary, and so on. But when you actually make lifestyle changes, you can have unbelievable transformations in the body. And I'm not getting into pharmaceuticals, but there are some appropriate uses of pharmaceuticals that I call them a bridge to health, that can really help to slow a lot of the progression, reduce the symptoms in a very safe way while you work on healing the body. And sometimes I have to give hormone therapy in terms of giving human bioidentical estradiol and progesterone. It's one of those catch-22s. You have to sometimes give the hormones to allow the body to heal. And then once it heals, you don't have to give the hormones because it'll make them so much better and naturally by themselves. So sometimes you have to give drugs to slow the production of testosterone. You have to do, I'm an MD. I will prescribe drugs when they're needed, but I always look at what's the safest way, what's the most efficacious approach. And what are the risks and benefits of every drug? So I just want to leave a message of hope that if you have PCOS, there is so much that we know now that I didn't know back when I was trying to figure out what was wrong with me. And you can get your life back. You can have a beautiful life, and don't give up. Okay. Keep working till you find the right person to help and work with you. And for people who want to learn more, I also wanted to just share that I have a health summit that's coming out right after Thanksgiving from on November 28th to December 4th, being produced by Dr. Talks, DR, and then the word talks, that's right next to it, Dr. Talks. And it's the PCOS SOS Summit. So I'm the host, and I interview like about 50 experts in the field, and we cover so many aspects of PCOS that you will just eat it up. And so I just want people to know that this is available and it can be purchased, but it doesn't have to be. It's available free online, and anyone who signs up can access it. And if you go to Dr. Talks, you can sign up, or if you go to my website, you can find it as well.
Yeah. Also, make sure to include a link in the show notes so people could register for the upcoming summit. And where could people learn about your books or buy your books? I mean, Amazon, but can you also mention your website? What's your website?
Oh, sure. So my website is named after my medical practice, which I am in. This is actually a converted exam room. I have an exam table over there. So this is my makeshift studio. So it's called the Integrative Medical Group of Irvine is the name of my medical practice. It's a brick and mortar practice. I see patients all the time. I also can do telemedicine. And my website is integrativemgi.com for Medical Group of Irvine. So it's integrativemgi.com. And, I hope that you'll come and visit me, and maybe I can help you, and follow me on Instagram. I try to post reasonably frequently. I wish I could get to time to do more, but that my Instagram is dr period. You got to put the period in, dr period Felice Gersh, for Dr. period Felice Gersh. So, and my books are available. I mean, they're on multiple sites, but the easiest, of course, is always Amazon.
All right, wonderful. Again, we'll put all these links in the show notes to your summit, to your website, to your books. And thank you again, Dr. Gersh. It was a pleasure chatting with you about PCOS, talking about estrogen, and thanks for tying it into thyroid health. Again, just I'm sure my listeners learned a lot, and I did as well.
My pleasure. And just anyone who needs me, just let me know, because that's my mission, is to help women with all sorts of problems. And thank you so much for inviting me on.
Yeah, thank you. Yeah, and again, definitely visit Dr. Gersh's website if you need a consultation, or again, if you want to check out her books, and definitely register for our summit.